Good evening, everybody. This is Dr. Kelly Teagle from WellFemme, and I'm here to present a webinar for you this evening about perimenopause. And joining me this evening, I have the lovely Jo Pybus, as you can see in the panel next to me there. Jo is a writer and columnist here in Canberra. She's also been a triathlete in the past and a business owner. And more recently, you might have seen Jo as a guest on the SBS Insight program about menopause. Hello, Jo, and thank you so much for joining us.
Hi, Kelly. Hi, everyone. Thanks for having me along. I'm really excited to listen to your story, Kelly, and to, I guess, share mine, because I think the more we share about this, the better it gets.
Absolutely, absolutely. No, I'm really excited about all of this. And yeah, I'd love to know who's there watching us tonight. So yeah, feel free to use the chat box there that is down. Well, mine is down in the bottom right-hand corner. I don't know about your screens, but feel free to say hi. As we're going along, please post any questions and comments that you've got. The format tonight, oh, hello, Michelle. I've got one. Excellent. Yeah, I'm going to be letting you know as we go along. We'll be able to answer your comments and questions. It's going to be about 20 to 25 minutes of formal presentations from Jo and myself. And then we're going to talk a little bit about our stories. We'll have some discussion and some Q&A and get to your questions. Oh, look at this. Thank you all for saying hello. I've got Emma, Lisa, Gillian, Simone, Vicky, Sherelle, Meredith, Megan. Thanks, everybody. Great to see you all this evening. Now, just so you know, as well as being able to post along as we go, if you haven't been able to catch the whole video, you're going to be sent a link on email afterwards. So you'll be able to watch the webinar, recap, remind yourself, refresh yourself on any of the things that you've missed. I'm going to be doing a blog article to back this up as well, which will be posted in the next week or so. And yeah, it'll also have the webinar embedded in the blog article on the WellFemme website. So just before we get started, I'd like to remind you all that this presentation this evening is actually for informational and entertainment purposes. So it doesn't constitute individual medical advice for any of you. As always, you do need to seek the advice from a doctor who knows you well and knows something about your symptoms. So without further ado, and hello, all you lovely ladies, Lisa, Rachel, Catherine, Bridget from Byron, Tracy. Okay, thanks for joining us this evening. So to get started, I'm going to do a little bit of a slideshow presentation for you all, just to tell you a little bit about perimenopause in general. And I'm just going to enlarge the slideshow up here. No, I don't want to do that. So there we go. Okay, so to begin with, I'm going to talk a little bit about what perimenopause is, the definition, what the symptoms are, and how we manage those. And then I'm going to hand over to Jo. She's going to tell us a little bit about her personal menopause story and what she's learned along the way. Then I'm going to tell you a little bit about mine, and that'll lead into our discussion and Q&A session. Okay, so let's get into it. So, what do you think menopause is? Well, the official definition of menopause is when you haven't had any periods for 12 months. And most women will reach menopause between 45 and 55. But it's important to remember that about 10% of women will be outside this range, and 1% of those will even be under the age of 40. That's called premature ovarian failure. And menopause can be caused either physiologically, just a normal aging process, or by medical or surgical interventions. So overall, this is a little bit of a diagram to show you the menopausal transition. You've got kind of your menopause, the actual time when your periods stop for 12 months. But before that, in the lead up, you've got perimenopause. And then the period afterwards is called postmenopause. And the little circle, the pie graph, shows you the percentage of women that tend to get symptoms during the menopausal transition. The lucky ones, about 20%, don't get any symptoms. And then at the other end of the spectrum, 20% get quite severe symptoms. And as you can see there, there's a bit of a list of some of the typical menopausal transition type symptoms you might have heard of before. This is just an example of how I like to assess people's symptoms. So any of you who've been a patient of mine will have seen this symptom chart before. I love to be able to get an idea of exactly what symptoms you've got, and then if we intervene with any treatments, we can pretty quickly see down track which ones are getting better and which ones aren't. Okay, so getting back to the whole menopausal transition thing, I've broken that down a little bit more here with this diagram, and you can see what happens in the menopausal, the premenopausal time frame when you're of reproductive age. That graph there is showing a little bit about what a normal cycle looks like, and you can see this beautiful smooth peak of estrogen followed by a smooth peak of progesterone after ovulation. Then when you start to go into the menopausal transition, which is broken up into an early and a late menopausal transition, that's when you start to get changes in your menstrual cycle. So usually a bit of a difference in the menstrual cycle length and sometimes the heaviness. And as you can see, overall, throughout the menopausal transition, there's this sort of gradual decline in estradiol or estrogen. And at the same time, you can start to see a rise in follicle stimulating hormone, which is FSH, as you can see on the diagram. And that's because your pituitary gland is sending out follicle stimulating hormone to try and flog your ovaries to release more eggs. But in the end, it's not successful and it starts to fail. So that's the reason for the rise in FSH. And often doctors will test your FSH level to try and see where you're at in the menopausal transition. But I'll tell you a bit later why that is a mistake. Okay, and here's a little bit of an idea. You saw on the last diagram how the drop-off in estradiol looked like a beautiful smooth slide, but the reality is very, very different. If only it was a nice smooth transition like that, we'd have plenty of time to adapt to the lower levels of hormones. But instead, what we get here is you've gone from the nice regular little pulses in the premenopausal stage, then you get to perimenopause, and as you can see, all those reproductive hormones racing about all over the place erratically. And then postmenopausally, that will all calm down and actually give your body finally a time to adjust to the new lower levels of reproductive hormones. And that's when the symptoms will subside. So here is the problem, this middle section here that's very, very erratic. Breaking it up even further, and I'll just see if I can, yeah, there we go. So what I've got here is, this is known as the straw criteria. The straw criteria stands for Stages of Reproductive Aging Workshop criteria. This was where a bunch of very clever people who knew a lot about menopause actually got together and decided how they were going to classify the different stages of menopause. And the FMP is the final menstrual period. You see up the top there, that's like time 0. So everything else leading up to that, it's kind of like a countdown going up to the final menstrual period. And you can see how you've got the different kind of sections there, the reproductive phase, then you've got the menopausal transition and postmenopause. And it also shows there the different kinds of levels of hormones lower down, how there can be a great deal of variability in the different phases. So, you know, getting to sort of more specialist doctor type territory, this is how you can actually classify which stage you're at. And there are very distinct diagnostic criteria for each of those different stages. But you know what? The reality is that it doesn't really matter in terms of treatment what stage you're at. It's not really necessary to pinpoint exactly which part of that transition you're in, because symptoms are still going to dictate exactly what treatment you get. So diagnosing exactly where you're at, not so important. So here are the symptoms during the menopausal transition. Now let's see if I can get this up a little bit. There we go. There's me and Joe back again, just so you're not so bored looking at a white slide. I should have warned you, Joe, in case you were picking your nose or something.
Kelly, can
Yeah.
I just point out to everyone that that graph that showed, you know, the stages of, you know, pre and peri and then menopause, the perimenopause was akin to a toddler left in a room, an angry toddler left in a room with a crayon. So I think that pretty much describes perimenopause. I think we're done here tonight, ladies. We can finish it up there.
That's right. See, maybe he's a future reproductive endocrinologist in the making. You never know.
Yes.
Yeah. So yeah, just getting back to what the symptoms actually are. Okay, so what are the symptoms that you can expect during the menopausal transition? The first point to say is that you don't actually have to have finished your periods before you start to get symptoms. So this is where it can often be a bit of a trick when the doctor says, no, 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 you're not in menopause because you're still having periods. Well, don't be fooled. The symptoms can start way before that. In most women will experience symptoms for about 3 to 6 years, but some unfortunate ladies can actually go on for decades potentially. So that's where it gets really important to get on top of the symptoms early in case they need to be continued on for a while. As we saw in that pie graph earlier, about 80% of women are going to experience symptoms at some stage during their menopausal transition, and about 20% will get them quite severely. But the interesting thing is that if you ask a bunch of ladies in their early 50s, about half of them will tell you that they're getting fairly moderate to severe hot flushes. But how many of them do you think are getting effective treatment? Well, the sad news is about 85% are not getting effective treatment, and that makes me quite sad, knowing that there are really safe, effective treatments out there. This is what that looks like. So if you looked at 2.6 million, this is from 2016 data, I should say, but 2.6 million women who are aged between 40 and 65 in Australia, and about 500,000 of those are getting moderate to severe hot flushes at any given time. And 385,000 of them are not getting effective treatment. So that's an awful lot of lost productivity and cranky mums out there, I can say. All right, so just to finish off my bit here, because this is a real Cook's tour, a real whirlwind tour of perimenopause, but I just wanted to touch briefly on, if you get that bunch of symptoms during perimenopause, what can be done? And there's lots and lots of things. From a hormonal management side of things, there's kind of a few different approach. You might, if you're getting a lot of erratic hormonal fluctuations because of erratic ovulations, the best approach might be to try and suppress your ovulations. And we can do that perhaps with the pill or with an implanon or depot injections or any number of different hormonal treatments. Then another approach might be to, if we don't or can't wanting to suppress the ovulations completely, we might just sort of see what happens if we give the woman a bit of an estrogen supplement so that it's buffering the deep lows in her fluctuations of estrogen to see if that helps to buffer the symptoms she's getting as well. And then there are also some symptoms that might be a little bit selectively treated. For example, some breast tenderness might be able to be treated with a particularly selective progestin, which is a synthetic form of progesterone, might help to alleviate those symptoms. So there are a range of hormonal treatments for a variety of different approaches. Then again, we've got non-hormonal medical treatments as well. So for mood symptoms or hot flushes, we might use antidepressants, for example. Or for sleep difficulties, we might approach that with some melatonin. Or if you've got urinary urgency, we might treat that with a special medication to help make your bladder calm down a little bit. So other sorts of symptom targeting medications are available there. Then the complementary and herbal therapies. Look, there are some of those that might be relatively safe and effective, and I think the important thing there is to do your homework really well. I would recommend sources like the Australasian Menopause Society, who has a pretty good rundown on the latest evidence with regard to complementary and herbal therapies. I know Ginny Mansberg's book, The M Word, had a really good section that was very extensive. It covered a lot of the different herbal and complementary things very, very well. So make sure of the evidence, I would suggest, because they haven't been well studied in a lot of cases, and we don't know the long-term safety, even if they are effective. So yeah, just be wary in that space. Lastly, and I'm going to get rid of our heads here again, Joe, the lifestyle and environmental approach. Of course, that's always one of the primary things there that we look at. That's the first line of action, is just to look at what you can do in terms of improving your lifestyle or doing things to make yourself more comfortable or to help you be more relaxed and manage your symptoms better in general. So this is the sort of stuff like exercise, counseling, CBT, sleep hygiene, just simply taking your clothes, off if you need to, or putting a fan on. Lots of different things there. So that all makes sense anyway, doesn't it? So yeah, I'm going to finish up my little bit there. I just wanted to give you a brief intro to perimenopause and the issues related to that and the possible approaches. And now I would ask my lovely co-host Jo to give us a bit of a rundown on her story, which you might have already heard a little bit of on SBS. But yeah, I really want to know, Jo, particularly not just about your story, but what it taught you about menopause and perimenopause, and your approach to how you managed your symptoms.
Thank you, Kelly, and thank you so much for having me along. This is great to continue this conversation after Insight. Can I just say a big welcome to those of you who are dialing in from Victoria, that you've gone and spent this hour with us rather than at the pub that you can finally go to. So well done. Anyone going through perimenopause and being in Melbourne over the last 104 days, was it? You're amazing. Well done.
We'll go down the pub afterwards, John.
That's right. You deserve it. I don't condone a lot of alcohol, but you definitely deserve a drink. Now, thank you again, Kelly. Yes, everyone, I'm Jo Pybus. I'm 53 years old. I've been married nearly 30 years and we have 3 adult kids. And I am still perimenopausal, so I'm getting close to that sort of hitting above the average. I think that it was probably in my mid-40s that I started to have signs of perimenopause. But I was really in that sandwich generation at that time, having teenage kids and aging parents. And there were a lot of things happening in our greater family unit at that time. So I was a bit distracted to probably take too much notice. I was also very fit at that age. I had taken up triathlon and cycling in my mid-30s, which was new and different. I hadn't been particularly sporty before that. And I was really fit and in a really good space physically. And I was used to training really hard and feeling sore and exhausted, but in an exhilarating sort of way. And it was when I was 48 that I started waking up feeling like a bit of a train wreck. So the sleeplessness had started then. And I was also waking up with very sore teeth and jaw, and went to my dentist and got a splint made because I was suffering from bruxism, which is clenching your jaw, and that extends to some people to grinding their teeth. And that certainly resolved any ongoing damage to my teeth. But the sleeplessness was certainly there to stay. I also, at that age, started to get much heavier and more frequent periods. And over 4 years, I ran a 21-day on average cycle, sometimes 16 days, sometimes, if I was lucky, 24 days. And so that was playing havoc with my iron levels and my energy, and making it really hard for me to compete and train for what I had a passion for in my triathlon and cycling. So I thought, right, I need to go along and see my GP. So I did that. Now, bearing in mind, I was not in any ways thinking about the big M word at that time and going to that doctor's visit, because I was one of those people that obviously Kelly's just talking about, that thought everything starts when your periods stop, and mine were getting quicker and more frequent. So it wasn't in my mind, and it certainly wasn't in my mind that the bruxism had anything to do with that at all. So went off to my GP. He did some blood tests, and when I got those results, he told me, well, I can tell you, yes, your iron levels are low and you're not in menopause. And I thought, interesting that, because I was actually sitting at the doctor's surgery that day with my big girl knickers on and a rather large maxi pad. So I'm thinking, thanks, buddy, but I'm pretty sure I'm not in menopause. And that was probably a bit of irrelevant information. But I guess he was trying to start that conversation with me. And that conversation went on to a little bit of HRT and where that might fit into my future. But I was very determined that we resolve my heavy periods, because I thought, if we could stop the heavy bleeding, I wouldn't lose so much iron, I could continue on, and that would be my panacea. So he referred me on to a gynecologist, and we discussed having a marina put in or an endometrial ablation. I think that's the term. And remember those things if you want to know what they are, and ask Dr. Kelly in your chat later. And I was very, very quick to sign up for the endometrial ablation. A friend of mine who had also had very heavy periods had that procedure, and it was a great success for her and very important to her because she was struggling to get to work and having to have days off work. So it was very disabling. And so I thought, that's for me. And I went home and I had to wait 2 weeks until they contacted me to make a time for that procedure. And I started to look on Google, and yep, there was lots of information, of course, some accurate, some inaccurate, but it was the first time that I was introduced to the term perimenopause through the internet. And it was the first time I had any concept that all these things could be happening to my body whilst I was still menstruating. I thought it all happened after you stopped. So I decided that I needed to have a really big rethink, and clearly I didn't know enough, and I completely put the brakes on. I cancelled the ablation and buckled up for the ride, and I have been riding that pony for the last 5 years. So over that time, I can tell you that physically I have experienced what I've already discussed, but also hot flushes, which for me have really been at night. So, and at the moment, this week particularly, interesting enough, 3 to 4 times a night. So throw the doona off. Sometimes I get up and go to the loo because it sort of resets me to go back to sleep, but clearly that's very disruptive to sleep. Aching joints and sore muscles, but not associated with exercise. So that was also something new and different. Itchy and crawly skin, and sometimes I've had my skin sort of go dry and crepeish, and then it goes away again. So yeah, nothing that stays with me too long that has triggered my concern to go to a doctor, but certainly coming in and out. Digestive issues, and I think really when you're not sleeping at night, my understanding is your body does a lot of digesting of your food. Of course, that's going to start to play havoc as well. Sore and swollen boobs. And I say this with my eyes rolling back in my head because about 3 weeks ago this happened, and oh my God, it's like when you know, of course, when you've just had your baby and your milk comes in and you're fully engorged, and, it's so sore, and, you roll over at night and land on your boob. So that wakes you up as well. So really, there's not a lot helping sleep there, is there? Problems urinating. Once again, never long enough to send me off to the doctor, but one day I'll want to wee all the time and there's nothing there, and then the next day I can go 3 hours and wee like a racehorse. So inconsistent and annoying. Excessive facial hair, yep. I don't think any of us are getting out alive on that one, ladies. So yeah, lots of treatments there. And the number one, of course, sleeplessness. Yeah, it's sort of, I think if you could get on top of your sleep, everything else would be a little bit easy to cope with. They're the physical things I've experienced, but I think the biggest challenge for me has been mentally. I have had heightened anxiety, at times loss of confidence, brain fog, forgetfulness, probably what I'm doing here now at times, short fuse, overly sensitive, and sometimes I just completely lose my words in a conversation. And that's really hard to deal with because that's your mental health, and you start catastrophizing things and thinking, well, I'm clearly early onset Alzheimer's, I've got dementia, it's very disabling, and it has been for me. Now, as to my current status, where am I today? Well, Jo Pybus, 53 years old. Those of you who saw the SBS Insight episode on menopause, which is it's on SBS On Demand, you can go and watch it. I recommend you do. It was in sometime in the last 2 months. They also had me do a promo that they used on Facebook called a My Story. That has been viewed over 100,000 times. So 100,000 people. I announced to them all that I am Jo Pybus and I have gone 6 months without my period, and in 6 months' time I'll be in menopause. Well, hold the presses, ladies. Here's a scoop for you. a month after that episode, and I think in that studio that day at SBS, there must have been a room full of hormones because it set me off. I'm blaming them, and I had my period again. And so I've had to reset, and I'm now 11 months away from realising that goal, where I'm fully aware that doesn't necessarily change everything, by the way. I know that I'll still have lots to deal with. And so I'm going to be 54 next year and still saying I'm Joe Pybus and I'm perimenopausal. That's me in a nutshell. That's where I am currently. So, yeah, over to you, Kelly.
Yeah, no, thanks very much for that. It's did you notice while you're in perimenopause, did you notice that if you went for stretches of time, longer stretches of time without periods, that your symptoms would get worse?
Interesting enough, so I went 6 months without a period. The first 6 months, I still had lots of hot flushes, but sorry, the first 6 months. See, there you go, brain fog. The first 3 months of that 6 months, everything was still pretty full on and night sweats and all that sort of stuff. But the second half, I started to get slightly better sleep and I didn't have any hot flushes. But since I've had that period, they're wound up again. I'm back in that hamster wheel.
Oh, you poor thing. Well, thank you very much. And can you tell us, Joe, what do you think, like, if you had to have a little take-home lesson, something like a little kernel of wisdom that you would say to other women who are perimenopausal, some light at the end of the tunnel to give us hope, what would you say?
Look, I think I could share with you, if you like, if this is what you're asking, the things that have helped me. Yeah, okay. So the things that have helped me have been educating myself. I was clearly behind the 8 ball. And, that's my soapbox on this subject, is that why didn't the hell I know all this? That would have been really helpful and stopped my catastrophizing and things. So quickly educating myself, because that has given me reassurance that all these weird things that happen, it's perfectly normal, Oh, yes, that's spoken about a lot. So that's reassuring. Things that have helped have been engaging with my friends and having discussions with them. They may call them interrogations, but, I'm open for asking them questions. So, I've got friends that are in menopause. I've got my 2 best school buddies who we all went through, similar ages, but went through very different experiences. So just talking to them has been so helpful. There's lots of forums and online stuff, Kelly, but Kelly, that's a double-edged sword.
Yes.
And I would be, just a word of warning, ladies, misery likes company. And sometimes when you go onto these forums, you can come away feeling worse than ever. So you really need to work out, did I get some really good information? Am I better for that experience? And if you're not, maybe that's not the forum for you. I've had that experience and had to leave forums because I'm thinking, yeah, I'm actually, wanting to open another bottle of wine after that. So
absolutely. You become those messages that you consume. And if you're surrounding yourself in negativity, it's hard to feel positive and to, move forward in a positive way. So I agree totally. I think, be very, very careful of the company that you keep.
Yeah.
And the messages that you're surrounding yourself with and listening to.
Yeah. And I think the other thing that's been really helpful, and a lot of these things I'm talking about now have been me, what I've needed to do. And one of the big ones was acceptance. I just had to yield to the expectations of these things and accept that's the way it is. And so, in talking about my friend that had the ablation, she absolutely needed to. I think her situation was much more dire than mine, and she needed to get to work. I work from home. If I've got to sit in bed, wrapped in, half the family's towels and, I don't have to go out in public and embarrass myself. So I could manage that. I don't have to go and do triathlons at the moment, so I could manage that. So I just had to accept that's the way it is and respect my body needed this time and space to go through this. And I'd like to have this internal dialogue with myself. You can use this, ladies, and that is that we talk about our hormones. Well, I call them my whores that are moaning. And I listen to them and I let them have their say and then I tell them to bugger off. So, you've really got to have a lot of self-talk about this, I think.
Sometimes, yeah. Actually, and one of the ladies has asked, are you on HRT now, Joe?
Yeah, so no, I'm not. I'm very open to it, very
Mm,
open to it. I'm not in any way scared of it. Have been well read and versed on that, but I just haven't got to a stage yet where I've really had to pull the trigger on that.
mm,
But I'm really am in tune and listening to my body. And ladies, do understand I'm very fortunate to work from home in hours that suit me.
mm,
So if I have to just go down for half a day, I'm fine to do that. I completely understand not everyone is in that situation.
mm,
I have bitten down on a stick quite a few times, and
mm.
perhaps at times I think, oh God, should I have done something? But then I get a little tiny ray of sunshine and says, well, actually, I think you're okay for a couple of days. So, um, very still open to it. So not yet is the answer.
Just going to that, so in my own situation, as you're aware, Joe, I actually went through a fairly early menopause myself, and so I was only 42 when it happened. And even though clearly I'm fairly well educated about women's health and things like that, it didn't really occur to me at the time that that was going on, because I did have a lot of stressful life circumstances at the time as well. So it's easy to miss when there's a lot of background noise going on in your life. When I did realize what was going on, and in my case, because I was young, the blood tests were helpful in working out that that was the problem. So for my situation, because I was having quite severe symptoms and was going through fairly early, HRT really helped. So for me, it's been a godsend. It's been it's helped me to keep an even keel, get rid of the worst of the hot flushes, and help keep me functioning. So it's different horses for different courses, isn't it?
It is. It is. I can see a question there from Tracy. How did you
Mm,
manage your anxiety and loss of confidence? Oh, look, I've got to tell you, it's an ongoing battle every day.
mm,
I just rationalize it. I know that viscerally that's how I feel, but intellectually I know it's my halls that are moaning. And
mm,
I just say, go for it, girls. Give me what you got. I'll lie in bed with a cup of tea. But I
mm,
know that's not me. And I know that this is a phase that I will get through. So I just try and keep that self-talk going that says, it's not real.
mm,
Um, sorry, it's real in regard to my body is being hit physically hard with these altering hormones that is causing this to happen. So
mm,
there's a reason for it.
mm.
And I love listening to podcasts
And
and
knowing that, being well informed and knowing that does actually, knowing that it's going to pass, that the likelihood is that when you get through this instability with your hormones and everything settles down, that your body will adapt to that. So it's knowing that. Whereas if you don't know what's happening to you and you don't know that there's going to be an end in sight, it can be that much harder to cope with, can't it?
yeah, very much so.
Yeah. Okay. Well, with that, why don't we get into some questions? We've got lots of lovely questions that I can't wait to sink my teeth into. Nikki started off by asking, is the age your mother goes through any indication of when you will? And why do doctors tell people they are too young to be in perimenopause? Excellent question, Nikki. Look, I think like anything, there's a varying levels of expertise amongst doctors about perimenopause, but clearly women can go through quite young. So you never say never. We saw a lady on the SBS program that went through menopause. Was she only 23 or something like that? So,
Yeah. Hmm.
it has to be considered, particularly if you've ruled out a whole bunch of other stuff. And Nikki, the age that your mum, sisters, grandma went through menopause can be indicative, but you might be quite different. Trend wise, yes, it can sort of give you an indication that you might be headed for an earlier or later one, but it doesn't hold firm. So, and then Sheila asked, is it possible to get hot flushes sometimes while you're on hormone therapy, especially when it's close to a period? Because she's peri and she has low progesterone levels. So, look, I would have to say absolutely yes. The thing to remember about any kind of hormonal treatment for perimenopause is we're not trying to restore your reproductive hormones to the levels that they were when you're in your young fertile years. That's not the aim here. It's about treating the symptoms. And so if you're getting hormonal fluctuations all over the place, and by giving you a baseline level of estrogen, we can help to buffer that and make the symptoms less, that's what we do. But you're always going to have the occasional breakthrough one, the rogue hot flush or something. You could treat yourself with super high levels of estrogen and probably still get the occasional ones. So it's unusual that you would get none, but you can certainly get much, much better symptom control that way. Now let's have another little stroll through these questions here and see what we've got to answer. Meredith does have an endometrial ablation question for us here, Jo. She had one at 49 to reduce heavy periods and hasn't had a period since then, but she's unsure what stage she's at, and now she's 54. And should she have tests to determine what stage she's at? Well, Meredith, as I showed you in those graphs earlier, you can be at any of those different stages. You may not actually finish ovulating until your late 50s. And sometimes you can get a clue on that because you feel cyclical, you get cyclical breast tenderness or moodiness or something like that going on. But also, as I mentioned before, it's not really important to know exactly what stage you're at unless, for example, it was going to make a difference to the treatment, like whether or not you stopped your contraception. So, really it isn't that important to know. Just, I would take it as read that at 54, there's a pretty fair chance that you're either already menopausal or not far off. And really what's important here is as to whether or not you're having any symptoms that are causing you problems or dysfunction that need to be addressed. And so we would treat based on symptoms, not based on a blood test result or an age. Okay, who else? We've got Joe here says, is it worth having hormone testing once on HRT and struggling to find effective dose to settle the symptoms? I don't. Joanne, I don't do blood tests. I don't think that helps because we could have someone who still has quite bad symptoms and has quite good estrogen levels on their blood test, and then we might find that doing a trial of a higher dose estrogen does help to settle them down. So everybody's physiology being very individual, I think it probably makes more sense to do a trial of therapy to see if it settles the symptoms down. But then if you're not getting success with a reasonably high dose of hormonal treatment, then you would start to seriously look whether there could be other causes for the symptoms you're trying to treat. Because remember that not everything that causes hot flushes is menopause. There's heaps of other types of medical conditions and problems that can cause you to get hot and have hot flushes as well. So yes, do not fall into the trap of thinking everything that's hot flush related is menopause.
Kelly, I just spotted a question there from Julie. It's a sort of a longer question. I've actually experienced a little bit of that myself, so I'd be very interested to hear what you've got to say on that one.
Great. So read it out for us.
Sure. So Julie's written, during perimenopause, I had frequent episodes of chest pain or an irregular heartbeat, both of which were very disconcerting. All investigations and tests came back clear. It was never linked in any way to menopause, but I'm wondering if this is a common symptom as it has stopped since menopause kicked in.
Mm-hmm. Okay, so it's stopped since menopause kicked in. So during peri, she was having that. It's a very, very interesting phenomenon, and I do hear this quite a bit, that women will come in complaining of palpitations and anxiety, and it's a very, very common perimenopausal symptom. So I think even for women who haven't experienced anxiety or panic attacks in the past, that they're probably the ones that get taken by surprise the most. Also, there are lots of intricate little electrical systems in the heart that are going, and your heart has hormone receptors all over it like every other part of your body. So the hormonal environment is definitely going to influence, the physiology of how that all works, the heart rate mechanisms and that sort of thing as well. So, but I definitely think that it could well be that sensation of having palpitations, maybe feeling anxious with it, or because you're not sure what's going on when you're feeling those palpitations, it makes you anxious and that makes the palpitations worse. It certainly is something that I've seen quite a lot. Have you experienced that yourself, Jo, did you say?
Yeah, look, I think definitely, settling the heart down a little bit. And I think for me, I probably would align it with a bit of that anxiety that I said I've experienced. And, yeah, I can feel myself winding up. It sounds like with Julie, they, to have to go and get them checked, that they were and tested. They're obviously quite a bit more profound than that. And look, Rachel Smith said she's also had the same as Julie, so it's obviously out there. And I guess it's just reassuring, Dr. Kelly, to hear that, yep, it happens, and to feel, I guess not too alarmed, but you certainly get that ruled out. And I think that I've spoken to friends about this particular issue before, and it's the same old story, is they just get looked at quizzically when they say, could it be to do with perimenopause? And the doctor's like, what are you talking about? And it's very alarming when your doctor's looking at you like you've got two heads, when you are a rational woman and you're an intelligent woman and you know your body. And so, and
the important thing here, of course, is that if you go to your doctor saying I've had chest pains and palpitations, you can't, they're not going to be jumping straight to the conclusion that it's perimenopause either. They're going to be wanting to do an ECG. They're going to be, if the palpitations and the chest pains recur, the instruction's going to be go up to the emergency room straight away and get checked out. Because if you go there, they put you on an ECG. They do blood tests looking for the hormones the enzymes that are associated with a heart attack and things like that. And if they find that that's all clear, then that's more reassuring for everyone. Then you can kind of go, okay, what else could have caused that? And you can start to maybe reflect on that in the context of your perimenopause and the other symptoms. But it's very, very important. You don't mess around with chest pain, ladies. And so if you've got chest pain and palpitations, always get it checked out, because there's a real reason why ladies do so much worse with heart attacks when they show up to the hospital. It's because we always get there so late, because we always assume it's something else.
Yeah, yes. Oh, absolutely. You never are going to regret having called the ambulance or fronting up to emergency, I don't think.
No, for sure.
That's what they're there for, ladies.
Disease is the equal highest killer of women in this country. So, we've got to really be mindful of what our real risk factors are, I guess. Now, let me do a little bit of a stroll. Do you want to pick out a question we haven't had yet there, Jo, and read it out for us?
Well, I just want to acknowledge that, Emma, you've talked about that you've on the for anxiety, whatever that medication is, love. I'm not a doctor, but good on you. What can I say? I just think that's brilliant. I think that if you saw the SBS Insight episode 2, one of the ladies was on anxiety medication, and it blurted it out to the entire country on that show. And it's really great that you share that story and reassure women it's perfectly okay as well. I mean, I think there's a stigma around menopause, and then there's a stigma around mental health. So when you talk about mental health and menopause, oh my God, ladies just crawl in a corner for 10 years. And so thank you, Emma, for saying that and sharing that, because I just think that's really important.
That's a really important point, because so many women that I talk to about both HRT and about antidepressants, both of which are very valid treatments for a variety of different symptoms, and they have a lot of crossover in their uses. But, there's this stigma associated with it that people think, oh no, I should be able to cope without it. I like, what is that? Is there a prize for getting to the end without having any medication, even if you've been miserable? I think it's all about quality of life. And yes, everybody's preferences are valid and count. Maybe you're throwing the baby out with the bathwater by not considering all your options and being well informed and open to various things. So thank you for that, Emma.
Dr. Kelly, you might want to answer this one. Lisa's asked, what treatments are safest for women who are at greater risk of breast cancer?
Yeah, thank you for bringing that up, Lisa. Of course, there's the world of non-hormonal treatments that are quite safe and effective, and the lifestyle things and environmental things. But if you're talking about hormonal options, so breast cancer risk, you may be aware that there is some evidence about certain types of HRT being associated with an increase in breast cancer risk. What the evidence shows is that after 5 years of use, there are certain types of synthetic progestins which can very slightly increase your breast cancer risk. And that's to the amount of about similar amount to if you were drinking 2 glasses of wine per day. So to put that in context, if you're 20 kilos overweight, that's doubling your risk of breast cancer. So lifestyle things actually are much more powerful in terms of contributions to breast cancer risk. But having said that, we do have some forms of progestins that we can use in combination with HRT, which haven't been shown to increase breast cancer risk. And the two that we use most commonly are the Mirena IUD, which delivers progestins directly to the lining of the uterus, keeps the lining nice and thin and stable, helps you not to have any bleeding problems. And also the micronized progesterone. In this country, it's marketed as Prometrium. That also hasn't been shown to increase breast cancer risk. So yes, we do have options that haven't been shown to increase your risk of breast cancer. But of course, every woman has a 1 in 8 chance of getting breast cancer in their lifetime, regardless of whether they're on hormonal therapy. So everybody do your monthly breast checks, okay? Feel yourself up every month. Get to know what's normal, and if you get any lumps, go and see the doctor and get them checked out.
I think there's a really good question from Leanne there, Dr. Kelly. Can you see that one, the second from the bottom? And good on you, Emma. We've got you talking now. You go, girl. That's right. We'll bloody talk about taking Panadol, won't we?
Yeah, sure. Okay, so Leanne said, I've been getting easily injured, waking up with a sore shoulder, sciatica, bursitis, libido's up and went, yes. Not wanting to go to sleep, even weird food cravings. It's a cycle, and now there is weight gain. Does anyone else have these issues? What's helped you with joint issues, gentle exercise? My goodness, you've got a grab bag of things there, Leanne. Do you have any comments on those things at all, Jo, particularly the musculoskeletal stuff? Any tips there?
Yeah, look, I can only speak to that. Yep, I have experienced sore joints and muscles, not associated with exercise, very much related to clearly my hormones used to wash me with beautiful healing properties, and now they're just pissed off to wherever they go, and I'm getting nothing. So, I think we can pretty much say that's a part of this challenge. And yeah, that you're finding it really hard to, get anything more than a gentle walk these days. Well, hey, that's great. Do the gentle walk. I can speak a lot to the benefits of exercise because I've been an absolute maniac at it. And that can put some people off to listen to me because I guess I don't blame anyone for thinking, oh, well, that's what you do all the time. I'm, not like that. Well, I can tell you, ladies, that I never, ever wake up in the morning and think, oh, I feel like exercising. Quite the opposite. But what I do focus on is is reminding myself how I feel once I've exercised. And when I'm talking exercise here, I'm not talking you have to run for 5 kilometres, but just keep moving, I think is really important, Leanne. Don't allow yourself to seize up. I have a yoga mat, and when I'm binge watching Netflix, which has been an awful lot over the last 6 months, I'll sit down there and do gentle stretches, and that's my exercise. Your exercise might be I'll wander around the garden and pull out 5 weeds. Doesn't really matter what it is, but just keep yourself moving. Now, of course, when there are profound issues, of course, you obviously need medical help. But don't give in. If you can sit down and do a few, stretches of your legs, do them. And because there's a tendency, and I've found, to wake up in the morning and get out of bed and find it really hard to move. So, you've really got to fight hard against it, and it probably goes against the grain of how you're feeling.
Yeah, I look, a lot of my ladies that have met me before have heard me say it, but doing anything is better than doing nothing. And if you can snackicize, trick yourself into doing short bursts of particularly higher intensity activity, like short bursts of exercise, bike sprints or something like that, a bit like HIIT training. You might have seen that Michael Mosley documentary where he got all those sedentary office workers to do bicycle sprints for 1 minute a day. And in 6 weeks, all of them improved their cardiovascular fitness just on 1 minute a day. So, if you can, just make that commitment, commit to whatever you can and get started. It'll have that positive feedback effect of making you feel better about yourself. You start to make more positive food choices, and it has that knock on, you get into a positive cycle then where you just want to keep going. So, yeah, just get started and stick with it. Make a small commitment you can stick to. So yeah, we've got a few. Have a scroll through there, Joe. Tell me if there's some.
Yeah, look, I think the low libido and painful intercourse is coming up a couple of times, Dr. Kelly, and good on you, Ali. You've talked about Michael Mosley and it's worked for you. Yeah, you've actually just got to dig deep and do it, don't you, love? I think that's the answer there. But low libido and painful intercourse. Over to you.
Yeah, well, so I rather than going into a long-winded answer over that, we've actually got a previous webinar that I did with Marita Achey, my friend who's a pelvic floor physiotherapist. So go onto the WellFemme blog page and look up the blog article on sexual problems at menopause. And there's also a webinar embedded in there which goes into a lot of detail about libido issues. But I highly recommend Dr. Rosie King's book called Where Did My Libido Go? Because the bottom line from that webinar was that low libido is normal, like it's very, very normal. Somebody asked earlier, does your testosterone go down with menopause? Well, it's not so much to do with menopause as with general aging. Certainly your testosterone levels are half what they were when you're 40. They're half what they were when you were 20. And that's a big driver for your desire levels. So don't wait around to feel horny or you'll never have sex. You've just got to actually, if you want to have a good intimate life, and you absolutely can, just accept that it's normal not to feel desire and to want to initiate sex from a place of desire. But when you get started, when you're open to it and you can enjoy it, then that's fantastic. And so there's a lot of tips like that on the webinar and stuff about the different treatments for painful sex, because if you've got vaginal atrophy related to menopause, you can absolutely treat that very effectively. So you don't need to be putting up with that. And there's great treatments that you can work through with a pelvic floor physiotherapist as well.
Dr. Kelly, there was a note here just earlier on from Georgina. Could I be starting the Big M? Have had nights where I kick blankets off. Normally periods are 21 days on the dot. So I'll hand that over to you. 21 days on the dot. Is that how it's been all your life, Georgina? Because, oh my God, girl.
Yeah. Look, absolutely, yes, it could be. You could be in perimenopause. I don't know how old you are, Georgina, but really it doesn't matter. It makes it more statistically likely that you're in perimenopause if you're in your oh, that was thunder.
I know.
We're in Canberra, everybody. There's a thunderstorm. Yes, so you absolutely could be in perimenopause, of course, because we don't know exactly what age you're going to go through that. And also, I did see earlier someone had a question about sleep issues. So I just want to say again that we have got a webinar up about sleep issues that was done a few months ago now. I think I might have done that one by myself actually, but there's a blog write up about sleep problems and how to manage those, and a webinar for that too. So it's all on the blog page, the WellFemme website blog page. So check that one out. Are we getting to the end of our questions? Because we have had rather a long session tonight, which is fabulous. I'm loving the interaction, ladies. Thank you so much for keeping us on our toes and being so interested in all of this. Can you see any important ones there? Any big questions?
I'm just going back. I think we've sort of covered most things, and unless there was some new ones at the bottom. I'm happy, if you like, Kelly, to get on my soapbox and just cover a couple of things that I think are really important for us women moving forward.
Why don't you finish us off for the evening, given we've been going for over 50 minutes, Joe, and both of us are getting a bit hoarse, so go right
ahead. Okay. Look, I guess my soapbox, how did I come to be here with Dr. Kelly? How did I end up on SBS Insight? Well, I stupidly put my name forward and they accepted me. And then I had this sort of, oh my God, I'm about to go on telly. What the hell am I going to say? And it made me actually think about my call to action, because I knew that I was really confused about this time of life. But what am I bringing to the table here? Because I can't speak to the procedures. I haven't had any, and I can't speak to HRT and the medications. But I can speak to the mental health side of things and to the lack of information. And one of the things, ladies, I try to remain focused on, and that is that menopause is not an illness or a disease. I've never heard of a coroner's report citing menopause as the cause of death, although maybe in some homicides that might be the case. But I think we can safely say that it's a phase of our life, but we don't see it that way. We don't see it that way because society has a long history of celebrating the other two hormonal phases, there's the words again, puberty and pregnancy. So in puberty, we celebrate girls becoming women, and in pregnancy, we celebrate women becoming mothers. But menopause is shunned like some silent, dirty secret, an end-of-life condition, and best endured and ignored. And so I think there's a message in that we can probably all speak to. Our mothers didn't talk about it, or our aunts. Well, we're the next generation, so let's change that. Now, anyone that's heard Michelle Obama's new podcast, she's got an episode where she talks about menopause, and she talks about society making space for menopause, and she's quite right. And we need to apply the same, I guess, inference that we have applied to puberty and pregnancy to menopause. And so we can change the narrative to one of celebration and achievement and rite of passage. Over time, hopefully that information will be more forthcoming. More doctors like Kelly will step up and fill this space where it's really not been specialised, and our education and health support systems will change, because we're 50% of the population and we're all going to go through it. So vote 1, Dr. Kelly Teagle. There's your campaign speech.
Thanks for the vote of confidence. Look, I think anybody who's not Donald Trump is looking good right now. So, look, thanks so much for that. I mean, for my money, we talked about the risk of surrounding yourself in negative messages around menopause, and a big learning point for me, given that I came into menopause and actually sort of decided that this was going to be my path in terms of creating a new business around this, trying to help other women with menopausal issues. So, there's opportunities there. There's the confidence there of experience and learning, and, having good social networks and all of those things. There's so many advantages to being older and wiser and more confident, and not taking any crap from anybody. So I think just, use that power that you've got from this stage in your life, and harness that for good rather than evil, and we can all move forward, and just let's be leaders. Let's be inspirational leaders for the younger women, and educate them about what to expect, so that they don't have to be blindsided the way that our mums and we were at times as well. I've got a little slide that I got here, which kind of demonstrates now. Now I'm going to have to flick through all.
Me.
That's you. I've got to flick through all the slides again to get to the one I wanted to show you now, because I've started it again. But this is just a little slide to refresh your memory on some of the awesome things that there are about this time of life. The freedom to do some things that you couldn't do before, and just exploring the world with a bit of confidence, and shaking off some of those responsibilities that you might have had in the past. So thank you all for tuning in tonight. Thank you for your questions. I'm sorry if we didn't get to all of your questions, but feel free to get in touch and ask them through Messenger or Facebook or something like that as well. Jo, thanks again for joining us.
Thank you, Kelly. I could just point out, ladies, if you want to keep in touch with me, because I'm a writer and I have a keen interest in this topic as well. My name's Jo Pybus, and that's Pybus, and you can look me up on Facebook, and I'd love to keep in touch. Thanks, Kelly.
Yeah, thanks again, Jo. It's really good. And for all you ladies who are still there, watch out on your inbox for the webinar link, and also check out the WellFemme blog page so that you can see the write-up in the next week. All right, have a great evening, everybody. Bye.
Bye.